Good morning, everyone. It is my pleasure to have this opportunity. Today, my topic is applications of contrast-enhanced harmonic endoscopic ultrasonography in hepatobiliary and pancreatic disease. This is our hospital with 6 campuses. This is our team. This is our interventional ultrasound operation room. We do all kinds of routine intervention ultrasound diagnosis and treatment with advanced procedure such as EOS, PTCS, nanosecond knife. Today we focus on EOS. EOS was known as the third eye. It is less influenced by gas and bone. It can obtain high resolution ultrasound imaging of the gastrointestinal wall and peripheral organs. This is developing history of ultrasound endoscopy. Clinically, EOS is used to improving the efficiency of diagnosis. What's more, it has remarkable treatment effect. EOS has been included in multiple guidelines and norms, such as domestic guidelines and international guidelines. Contrast-enhanced ultrasonography has already been widely used in clinic. It also could apply in EOS when we called CHEOS. This is 3 kind ultrasound contrast agents: Sonoview, Definity, and Sonozoid. This can be used for CHEOS. The 2021 Asian Federation of Society for Ultrasound guidelines are the first guidelines to focus on CHEOS. It is mainly about 4 aspects. 1. Suitable contrast agents for CHEOS. 2. Differences between contrast agents. 3. Setting of mechanical index. 4. Dual imaging and duration and phases for observation. We now talk about CHEOS guidelines to be exactly. 1. Sonoview, Sonozoid, or Definity could be used as for performing CHEOS. 2. There is no clear difference in diagnostic ability. 3. CHEOS should be observed for 120 seconds. 4. It is necessary to analyze separately on early or late phase. 6. CHEOS is recommended for characterization of pancreatic solid masses. 7. CHEOS is recommended for pancreatic cancer staging in selected patients. 8. It has limited yield for the characterization and differential diagnosis of pancreatic cystic lesions. 9. Is recommended for detection of subtle pancreatic lesions. 10. It may be useful for the differential diagnosis of biliary sludge from other perfused gallbladder lesions. 11. It is recommended for characterization and guidance of EOSFA only in liver lesions with unclear margin, or in the case of previous negative EOSFA. In the clinic, CHEOS is a good complementary exam to conventional ultrasound. It can offer great help in pancreatic system, biliary system, hepatic system, radioperitoneum, and left adrenal. Now we see some applications of CHEOS in clinics. Case 1. The male, 52 years old, CT shows pancreatic tail mass. We see the lesion located here. With CEOS, the mass showed low enhancement in arterial phase. With CEOS guided FNA, pathology showed adenocarcinoma. Case 2. 50-year male with no obvious cause of abdominal pain. CT and EOS showed the cystic lesion in pancreatic head with uneven thickened wall, suspected to connect it with the widened main pancreatic. IPMN is considered. And CHEOS, the solid composition of the nodule wall on the wall were significantly enhanced. Peru to be IPMN. This is operation specimen. Case 3. Female, 65-year-old, morning fainting when fasting over 1 year. No pancreatic mass was found in CT, MRI, and conventional ultrasound, but the doctor still suspected pancreatic tumor, so EOS was performed. EOS showed a hypoechoic nodule in pancreatic head, which suggesting a neuroendocrine tumor. After this, we reviewed the CT imaging again, and we found a subtle lesion rich in blood. With CHEOS, hypoechoic nodule in pancreatic head shows the hyperenhancement in arterial phase. With CHEOS, guided biopsy was performed. The pathology showed neuroendocrine tumor. Case 4. 63-year-old female was admitted with sclerosis jaundice. CT showed ampulla and low common bile duct mass. The lesion showed slightly hyperenhancement with CHEOS and the slightly washout in venous phase. The biopsy was performed. With cytology examination, cancer cells were found and was proven by the operation specimen pathology. Case 5. Male 69-year-old abdominal signal showed in lower common bile duct on MR. With clear images of the EOS, we see the lower common bile duct narrowing and thickening, and finally truncated at the end. CHEOS showed the lesion slightly enhanced in all phases. The surgical pathology showed low differentiated adenocarcinoma in the low section of the main bile duct. Case 6. 73-year-old female, pancreatic neuroendocrine cancer resection 5 years ago. MR found liver metastasis. To define the nature of the tumor, US-guided biopsy was performed, but no abnormality was found in the left liver under conventional ultrasound. Then EOS FNA was recommended. EOS is not clear for the lesion, but CHEOS showed multiple left hepatic nodule annular enhancement in arterial phase and showed hyper-enhancement in the portal and venous spaces. Then CHEOS guided biopsy was performed. The pathology showed low differentiated adenocarcinoma. Case 7, 67-year-old male, as in soft tissue sarcoma metastasis to left adrenal gland, is hard to ablation trans-abdominal EOS guided, but is easy to do laser ablation by EOS guided. So we do CHEOS. The lesion shows hyper-enhancement throughout. Then 22 needle was punctured into tumor under the guidance of CHEOS implant long laser fiber. Then after laser ablation, we see the lesion enhancement throughout. We perform the CHEOS and the residue was showed on the right side of the lesion. Then we treat it again with laser ablation. After ablation again, we do another CHEOS. We showed residue again on the left of the lesion. Then we do laser ablation again. From this patient, we show CHEOS very helpful in post-operation evaluation. This patient, after 15 days later, on the CT images, we could see the tumor was almost ablated. There is little residue. So we summarize the advantage of the CHEOS is mainly about 3 aspects. 1 is diagnosis, 2 is guided biopsy, 3 is post-op evaluations. This is a summary of our relevant researches. These are foundations and articles. Finally, welcome to the 14th Congress of the Asian Federation of Societies for Ultrasound in Zhuhai, China, during September 16 to 19. Thank you very much.